Hello, everyone, and welcome to RevMD Sex Bites podcast with me, your host, Dr. Deborah Durst, and I have my co-host with me.
Hey guys, Verda Gombiewski, nurse practitioner here at RMD.
So today we're going to talk about all things men and erections and performance, one of our favorite topics and something we talk about every day in the office. And I bet that right now you're thinking about the little blue pill or Viagra or Cialis, because that's the first go-to solution with all men, right?
They have amazing marketing because all men know about the little blue pill.
All men. So, but there are so many other options besides the little blue pill, and that's what we're going to talk about today, is the other options for regenerating and increasing performance and getting harder erections.
So we talk a lot about hormones, right? So we'll start with that first and then go into some of the medications, some of the treatments, some of the supplements, things like that. But hormones.
Yes.
When we talk about any type of erectile dysfunction, you've heard us, if you've listened to any of our other podcasts, you've heard us say 20% is hormonal and 80% is blood flow. So 20% hormones. So that is not, you went to your doctor and your doctor said your testosterone is normal. Well, what's normal? That varies significantly from male to male by age, and really symptoms. So testosterone can be technically in a normal range, but you can still be having symptoms of low testosterone, such as erectile dysfunction.
Yeah, that's one of the many symptoms. And again, like Faraday said, that range is huge. It's huge. It's a big range in the 200s to 900. So you could have been 900, now you're 300, you're a third what you were, and you're still normal. So do you ever really want to be normal? No, you want it to be optimal. So we always talk about optimal. And that's why, because you want to be in the optimal range. You don't want to be 300 when you were 900 before. And now you're having symptoms of erectile dysfunction or low libido or low energy or brain fog, weight
low
gain.
Confidence.
Yeah.
Not recovering well when we're working out, doing the same thing you always were doing, but now we're gaining weight in the midsection all of a sudden.
Joint aches and pains. That's another one. And you don't sleep as well. There's so many things behind the scenes that you really don't think about too.
Absolutely.
As you're gaining weight, you're getting some insulin resistance, your blood pressure's going up, and your cholesterol and your lipid panels are looking worse. So there's a lot of
anxiety, depression's another one that we hear a ton of.
Well, and it's because it's a life force for men, and you guys have heard us before. It's a life force for men. So you guys are competitive. That's what you do with each other. You compete with each other. It's just kind of your way of interacting with the world and other men. And if you have a low testosterone, you lose that.
Absolutely.
You lose that zest for life. You just don't feel the same. You don't have that drive. You're not competitive. You just lose that edge. So you want to get your edge back, then you want to be hormonally optimized. Yep. And so always something to think about. So again, like Faraday said, 20% is hormones, 80% is blood flow. So if we're talking about blood flow, we're talking about regeneration of tissue and blood vessels. So it's not the hormonal component, but now it's regenerative.
Absolutely. Because a lot of times we'll have guys come into the office and say, well, I'm on testosterone. And then we have the conversation of, okay, well, what does that look like, right? Because there is multiple ways to replace testosterone for men. Some ways are a little bit more effective than others. So first we look at, okay, well, let's look at those hormones. And let's say your hormones, your testosterone is optimized. Your estrogen's good. Your blood count's good. Labs are looking good. So then we know it is not a hormonal issue. And we look at, like Dr. Durst said, blood flow. So there are a number of treatments that we can do to help with that. So let's start with Gainswave. We do a lot of Gainswave in this office. Gainswave uses acoustic sound wave, shockwave, to tell the tissue that there's damage so that it regenerates. Like Dr. Durst said, we're trying to make actual regenerative functional change by regenerating the tissue and letting that tissue know that there's damage so that those cells go for healing. We get better blood flow.
So your blood vessel walls, again, if it's unhealthy, those are the smallest vessels in the body. So 1 to 2 millimeters smaller than your coronary arteries, your carotid arteries. So it's a barometer of vascular health. So if you're losing morning erections during the night, which are nocturnal erections, then that's a barometer that those vessels aren't healthy. So when we do acoustic shockwave, we're telling the tissue it's injured so that you get blood vessel wall in, repair. And so basically healthier blood vessels, better blood flow, and harder erections. So we're doing that throughout the perineum, which is, the area of the scrotum, but not the scrotum directly. And then because those have the larger vessels, and then we want to do the penis as well. Those are the smaller vessels and the groin. So that's a better way. I said perineum. That's groin.
Let's talk about groin. You all know what your groin is. We're doing the whole groin and the penis.
It's the groin. We don't go over the scrotum. So, which is
all but the twins.
Yeah, the twins. Yeah. We don't go over this. That might be a little painful. But otherwise, it's not painful. It is like a 20, 30-minute procedure, no downtime, and no pain, unless we happen to go over the scrotum, which we don't, which is...
Why we don't?
Yeah. Which is the twins, the
first thing that came out of my mouth.
All that stuff. Yeah, I think that, again, for
the boys.
For men to know, it's like the ball sack, the nuts, the boys, just so that you guys sometimes we have to speak on your level so that you know. So anyhow, but we do that groin area to increase blood flow to the penis. So we want to get blood flow in, then we want to keep it there.
Absolutely.
And so that's part of it. The penis has what's called the corpus cavernosum on each side, which is really the reservoir for the blood flow. And again, I think a marvel of science, because where else in the body or in science can you get a 40 to 50% increase in blood flow to tissue in a matter of seconds?
And then it stay there.
Like, you don't want to do that in the heart. You don't want to do that in the brain. You'd have a stroke. And so, but in the penis, that is the function. You want to
That's the goal.
Yeah, that's the goal. Get that much in there. So now we want to keep it in there too. So that's what happens when you're doing acoustic shock wave over the penis. You're making that smooth muscle, the collagen elastin very firm to keep the blood flow in.
Yep. And when we are talking about Gainswave, there is a difference between acoustic shockwave machines. So Gainswave is a name brand. It is something that you guys have heard, but it can be used interchangeably in some offices, and that is incorrect. Gainswave is FDA approved and indicated for erectile dysfunction. So when we're talking about acoustic shockwave, we're talking about specifically Gainswave protocols, Gainswave providers. We've gone through those trainings. We use those protocols, and it does have an FDA indication. The other machines at this time do not.
So the big issue is that if you're looking for Gainswave and there's Gainswave directory of providers, they've been trained, they're using the right machines. If there is another name for it, like Wave Tech, for instance, where they're not actually. So to me, if your provider in your office isn't spending the money to get properly trained,
or to have the proper machine,
then are you really going to get the treatment? Because we have a lot of people come over from other offices that have a knockoff name for Gainswave, and again, Wave Tech, Wave Runner, whatever it is.
Oh my God, another name.
But anyhow, so I think Wave Tech is one of them. So again, but they come over unhappy with the results, but it's because they're not a Gainswave provider. So you don't know what machine they're using. You don't know what protocols. You don't know that they're using the right amount of energy. So you really want to look for a Gainswave provider, and Faraday is right. Those machines are, there's only a few machines that are in the Gainswave network that people actually learn the protocols with. So you want to look for a Gainswave provider.
And if you're here in Knoxville, Tennessee, you can come see us.
Yeah, come see us.
If not, definitely a very important key point when you're looking for these services.
So you can look up Gainswave in an area. So if you're in San Francisco, you can do Gainswave San Francisco, and there'll be a list of providers in San Francisco. So that's one way to get them. And it is a network of providers. They have paid to be trained on correct protocols. And so you are not guaranteed results. You can't guarantee results anyhow, but at least you have the best protocols, the best machines. You just cannot guarantee that the tissue is going to respond. And we say that without surgery, you're going to respond, but it might take 6 or 12 or 18 Gainswave. It depends on where you come in. But you need to go to a provider that's actually expended some money and energy and time to learn procedures that are going to be effective for you.
Same with, as we kind of shift and go to what pairs very well with Gainswave, is something called the P-shot. Just like with Gainswave, there are providers that are certified in the P-shot and have had paid for training and have learned the proper technique, the proper protocol, when to utilize it in treatment protocols and plans that have also, like us, we are trained in P-shot and Gainswave and certified, but then we are also able to train others.
Yes,
so we've taken that next step.
Yeah, so that we can actually train other offices to do it. So to get these great services out to other providers. The issue is, again, Dr. Runnels in Alabama was the one that, basically, I don't want to say invented, but formulated the whole protocol and has now a network of providers. And those providers also meet on a regular basis, on webinars on a weekly basis with him, so that if somebody has come up with something different to pair with it or advanced techniques, that everyone can learn those. You want to know that your provider has invested the time and the money and in learning what's going to work for you. And so the P-shot's awesome. So if you haven't heard about it, now we'll tell you a little bit about it. It's an amazing procedure. And if you haven't heard of PRP, then you will now. And again, we have other videos on it, but PRP is platelet-rich plasma. So we're going to draw blood, and we're going to spin it down. From you.
From you, Keith, not someone else's blood. It's your own blood.
So we're using your blood to improve your erections. And so we're using your blood to repair. So we're going to draw blood, spin it down, get the platelets. The platelets have growth factors in them. That's why your arm heals if you get cut. And so your arm grows back. So likewise, we re-inject into tissue so those growth factors can go to work. So with the P-shot, again, what's the big question all the time?
You're going to stick a needle where?
Yeah, exactly.
Usually we draw a beautiful diagram when we're going over this and go over exactly where the injections are. But we do a penile block, men. We do numb you. You do not feel anything base to tip, 100%.
Yes, and you will feel it again. We promise.
Yes,
like you will have.
Oh, that's the other thing is how long? How long am I going to be numb for?
I can't feel.
What have you done to me?
I can't feel it. Yes.
The lidocaine does wear off.
Am I ever going to feel it again? Yes, she'll feel it again. Or nobody would be doing P-shots, right?
Exactly.
So you will feel it again. I know that's traumatic, for men to not be able to feel the penis for a couple hours. It's part of your body being gone. I mean. Yeah. And probably the most important
But it comes back
for them.
And you'll be just fine. And you'll be happier for it.
Yes. No, absolutely. So we do blocks. So getting back to that. So we basically are numbing the entire penis for the procedure. Yeah. And so we put some topical on even before that. So men do great with the penile block. And the procedure is essentially painless, just so you know.
Yep. And most of our men are not just doing one P-shot. They're doing two. They're coming back in a year and doing it again. They're coming back 2 years out.
They would never come back.
If it hurt, they would never come back.
Yeah.
When you look online and you look at testimonials and you look at what other men are saying that have received the P-shot, it's not negative. So, because even at first when I started here at this clinic, I was like, I don't know about that. I don't have the equipment. I don't know if it hurts or not. And I started looking, and it was like man after man after man, even patient after patient after patient going, yeah, no big deal.
Yeah, no, they come back in for it because it is amazing at the results. And again, it improves, it's cumulative. So we do a scoring system. So when we're talking about regenerative procedures for erectile function.
So Gainswave, P-shots, how many, how often, protocols.
Correct, yeah. We're going to base that on a score called a SHIM score. And so that SHIM score gives us a number between 5 and 25. So we have an objective number. And then we can formulate a plan based on that objective number. So 5 means you have no function and there's a score. There's 5 questions. And there's some other questions that kind of give us a gross indication of what we should be doing along your journey of regeneration with your Gainswave and P-shot. But those 5 questions give us a score between 5 and 25. And so 5 means you have no function. So we have a lot of improvement to go. Or 25 where you have no dysfunction and maybe you
just want it to be better.
Yeah, you want to be better. Increase performance. You can never increase your performance too much. Yep. Men, definitely are always pushing to improve performance athletically and, in the bedroom.
And in the bedroom.
Yeah. So that scoring system gives us an objective number. So we know where to start and we kind of base protocols on that number. And so we go over that full evaluation with the patient when they first come in, including
and surprisingly, even a score of 21 and less on that scale indicates some form of dysfunction. So it does not, it can affect a very wide range of guys. So it doesn't necessarily mean, oh, I'm not a 5, I don't need Gainswave. If we're scoring at 18, 19, 20, 21, if we're right there and you're like, maybe it's not that bad, that's the best time to do it because that tissue will respond a lot better. We haven't gone all the way to the 5 end of the scale and we're trying to make a 15.
Yeah.
You know, if you're in 21, let's try to make you a 25 again.
Well, whenever I hear the question, is there any guarantee? The only guarantee you have is it's going to get progressive with time. So it's going to worsen with time. So 50% of men at 50, 60 at 60, and go back to 40 at 40, 50 at 50, 60 at 60, 70 at 70. So it's progressive, have low testosterone and or erectile changes. And so any changes, so men, you know, like if you're not getting nocturnal erections in the middle of the night, you're not waking up with a morning erection.
You're not getting spontaneous erections.
Yeah, and you're not able to perform every time, where maybe alcohol's, you know, always an excuse for men. You know, it's the alcohol. Well, it wasn't always the alcohol, though, was it? So that's a change. So you know the change. And so again, the last thing you want to do is deny minor changes, because that's the time to get on top of it.
Literally, figuratively.
I know. I knew.
Sorry, I couldn't.
I know. Well, I went
That's
to
what
say.
she said.
Well, I went to say jump on top of it, but no way I could change that to not make Faraday laugh. We both looked at each other with that.
Yeah,
one, so
that was going to be the end of that.
Yeah. So anyhow, so that is, you know, the time to start treatment. How about that one?
Absolutely.
Is that a better way?
No. So, so definitely you want to, once you start seeing those changes, most men wait too long. And we have a lot of patients in our office that say, I wish I would have done this 3 years ago. I wish I would have done this a year ago, 5 years ago. Insert the year time frame. Yeah. But there's no one that ever said, man, I did this too early. Yeah. I've never once heard that. I've never heard a gentleman say, I wish I wouldn't have done that. It's always, even though we don't guarantee a perfect result or we don't guarantee a result, every single one of our patients is their Gainswave scoring, their SHIM scoring is improving. They are noticing either more sensitivity, erections more frequently, stronger orgasms, and stronger erections.
Yes, yeah.
Everything is, or if we just couldn't get one at all, regardless of that little blue pill. Now, with that little blue pill, we have function consistently. Yeah. So we're always trying to go one better and improve.
And that's a great way to look at it. So, like, again, if you're on an injectable, you want to try and get to the pill. If you're on a pill to get an erection, you want to try and get to without a pill. Like, and if you're having minor changes, you want to have no changes. Absolutely. So you always want to improve it. Again, there's not a man that is not a candidate, because it will happen at some point, and once it happens, even minor changes, it will progress. So when we get the whole, is it guaranteed? One thing is guaranteed. Again, it will be progressive with time, and women have their changes. So it's not, absolutely, men are not alone. You know, all men are experiencing it. It depends on their medical history. It depends on, you know, surgeries. It depends on a lot of things, their health, their habits.
Absolutely.
You know, are you active? Are you healthy? Are you eating healthily? So it depends on a lot of things.
Do you have diabetes? Do you have hypertension? Yeah. Do you have cholesterol issues? Are we overweight?
It's going to happen, you know, at some point. And so minor changes, that's when to start. So the other thing is, though, is that you get the one and done. You know, so the questions we get, is it a guarantee? And again, the guarantee is it's progressive with time, and it'll improve, and it depends on where your starting point is, how long it takes. So we can get you there. But if you've never done anything to your house in 70 years, well, then you're going to have quite a ways to go. Like, you would have a lot of upkeep with that house if you hadn't touched a house in 70 years. And it's not like somebody has chosen not to do it. You know, to keep your house up. But we didn't know that there were Gainswave and regenerative procedures. And so now we do. So you can't come in expecting the same that we would expect in a 40-year-old that has minor changes. But we can get you there. Absolutely. You just got to commit to the process, and until we get you the results that you want.
Yep. So. There are also some natural supplements out there outside of the little blue pill, outside of the Viagras and the Cialis. So if you're having mild changes, we did a podcast on libido stim for men. check out that podcast. It goes into some supplements that can help naturally improve testosterone if we're having some mild changes, which can help with erectile function. We did a podcast on nitric oxide, another supplement that's fantastic to help with blood flow. So we're talking about blood flow and testosterone.
Yes.
So
and then
lots of
even the
things.
low dose, like again, the little blue pill or Cialis or Viagra, those can be compounded. They can be compounded in combination, low dose, so you don't get the side effects and they work better together. You get shorter and longer acting. So that's something we're very comprehensive in how we address it. And you want to find an office that is.
Absolutely.
So that you're again, there's a couple questions we can ask that give us a guide of what we should be doing for you during your regenerative process so that we can get you erections, because the healthier blood flow in during regeneration, the more regeneration you get. And so it's like a sponge. Like if a sponge is in a package and it's new and you open the package, it's nice and moist and it's healthy. But if it sits out, then it's dry and it's hard.
That sounds so terrible.
So that's what the corpus cavernosum is. It's a sponge. So you want to get healthy blood flow in. So we want to do Cialis, Viagra, Trimix if we needed to, if they were far advanced. And again, Berkeley Life. I know.
Anything to improve blood flow, guys.
But they understand the sponge thing.
Absolutely.
Like you want that healthy sponge.
Absolutely.
So, but there's also the Pygium, which was just interesting. That's another podcast that we did talking about prostate effects of a supplement and ejaculation volume,
which has, not been really proven anywhere that I can find to increase orgasm strength or improve that orgasm. But a lot of men have said otherwise with personal testimony, even when you're looking at the reviews for the product. They're funny. Look on Amazon if you want a good laugh.
That's Pygium, and that was another podcast that we did. And again, Trimix is an injectable that we can do. So even if you've had like a prostate surgery and we're attempting to do Gainswave or a P-shot to see if that's the one time when we're not sure whether it'll respond or not. But we can actually do some injectables if the erectile dysfunction is severe, or maybe there was a previous prostate surgery, so that you can at least get erections while we're doing the regenerative procedures, and
to see if we can get some of that feeling back.
Yeah, and blood flow in to make that make that sponge healthier.
There are also peptides. There's a peptide called PT141 that can help with increasing orgasm strength. So again, there is a lot of options out there, guys. It's not just the little blue pill. There is a lot out there. So finding an office that's extremely comprehensive that can talk to you about all these things and give you options can make a big difference. You do not have to have a one-trick pony.
No.
You don't have to have a one and done, because eventually you'll get to the point that little blue pill will stop working.
Well, and that was kind of the point with the one and done, is that nothing in life is a one and done. Your car tires are replaced more than once. Your brakes are replaced more than once. There's not a one
analogies today. You're just knocking them out left and right.
It's not a one and done, right? Nobody wants a one and done. No. So basically, once you get to where you want to be score wise, then there's an upkeep and a maintenance. So that could be yearly. That could be Gainswave. It could be, P-shot. It depends on the man and what they felt most responsive to sometimes. Absolutely. And when they start to notice changes, and some men like to have a Gainswave monthly as a maintenance, quarterly, once a year they do, a series and a P-shot. But there's some maintenance. Just know that.
If you guys have ever had any experience with Gainswave, P-shot, Viagra, Cialis, supplements, whatever it may be, leave a comment. We love to hear your responses. We love to get feedback from you guys. If there's something we haven't talked about that you've come across or are curious about, leave it in the comments. We'll check it out and maybe do a podcast on it.
And then just know, so again, we're very comprehensive. There's a couple of things we haven't mentioned, but we'll just touch on briefly. We do some IV therapy in our office, put amino acids in. Those amino acids will also improve your
so many things. We can't even remember them all for the podcast. And we should have made a list.
Penis pump.
Oh yeah,
as another
got to pump, guys.
Yeah, got to pump
more blood
during
flow, the better.
The more blood flow to the sponge.
Yeah.
Yeah.
Fill that sponge.
Fill the sponge. Get the butterfly. But the pump is very key. And again, these also work for all of these procedures, work for Peyronie's too. And we have another video on that. So we could go on. You know, it happens to be something that we feel very passionate about because there's lots of things you can do to help, but we need patience to commit as well. You know, we'll do our part. We need you to do your part. So if you guys have any questions at all, anything you want to hear more of course, like Faraday said, just drop it in the comments and perhaps we'll do a podcast on it.
Absolutely. Like, hit the bell, share. Sharing is caring.
Sharing is caring. Yeah.
Subscribe.
Yeah.
All the things.
Yeah, it helps get those videos out there for guys that are looking for solutions for erectile changes. So again, you know, let us know anything you want to hear about. And again, we're here to revitalize your look, your health, and your sex life.
Thank you.